After years of temporary measures, it appears that Congress is likely to permanently replace Medicare's Sustainable Growth Rate formula. I sat down with Dr. Ardis Dee Hoven, president of the American Medical Association, to discuss how things might proceed this fall. So why don't you start by telling us why it's such a great time to fix the SGR finally?
From a financial standpoint, the timing is good. There's good bipartisan support, in fact, excellent bipartisan support now. And the other thing that is very good about this is that America's physicians have united around the pathway. The pathway here being repeal the SGR, number one. Number two, replace it with updates stable updates for a period of 5 years, and then allowing practices and physicians to move into other models of care that they choose that are good for their practice and their patients.
And why is it so important to demonstrate to the members of Congress that these cost savings are coming in? How does that make a difference when you are talking to them about fixing the SGR, replacing it?
They are so concerned, and rightly so, as members of Congress, that they do have to be, that they are fiduciaries here. So any way we can demonstrate to them cost savings going forward, they're going to appreciate. They understand the need. They didn't know how to get there, but they understand the need for it.
Do you think the Affordable Care Act has sort of helped move things along in terms of the SGR? Now that we're seeing a lot of the new models coming into play, they're being encouraged by the Affordable Care Act. Has that in any way influenced maybe the thinking on the SGR?
It may to some degree. I think there's been clarification and more transparency around what physician practices do and how they operate. And I think as we look at access to care, all physicians and all kinds of practices are very concerned about making sure we can get it right and we do it right. And the Affordable Care Act has sort of opened the door to those conversations.
So we're hearing rumblings from Republicans on the Hill that they're thinking about holding up the government, essentially shutting it down if they can't take away money for the Affordable Care Act. Is it possible the SGR will get swept up in that debate and maybe put aside?
Members of Congress are very concerned about the destabilization of the Medicare program. I think it is unlikely that they're going to sweep it all under the carpet at the same time. But in fact, we have had wonderful bipartisan support. I do believe this is going to move on, and it has the potential to get where we need to be.
So what would the next step be? We had a bill come out of the House committee. What are you hearing on the Senate side?
We know that Ways and Means and the Senate Finance will begin their work after they get back from the break. How soon they'll mark it up, we don't know. We anticipate probably by September or October we're going to have a much better handle on what they're going to come up with.
So let's say we have an SGR fixed by the end of the year, we have it repealed and the replacement has been worked out. What does the future look like?
I think for physicians and patients, it's going to be a much better place to be. You will have stabilized the practices so that they continue to grow, so that they continue to improve healthcare for their patients. For the patients, it's going to mean better care. It's going to mean better coordinated care. It's going to mean better prevention and wellness care. It's going to keep them out of the hospital. And these are the sorts of things in this country we have definitely needed for a long period of time. I am very optimistic.